Good evening, everyone. Thank you for joining our laser season webinar, the ultimate guide to all things laser. We're excited to share with you all the laser devices and treatments that Synergy has to offer. We hope to get all of your questions answered throughout this webinar, and we hope you enjoy these presentations. We're very excited to introduce our newest piece of Cyton technology, BBL HEROic. This will be offered at our new Inside the Beltline location. What makes this technology different and special is the new 532 filter, which is going to address capillary damage and diffuse redness with all of the traditional benefits of broadband light technology. Sun damage, rosacea, broken capillaries, acne will all be treated with this device. We hope you enjoy this demo of BBL HEROic.
Introducing Synergy Face and Body's newest laser edition, BBL HEROic. BBL HEROic is the latest and most advanced in broadband light technology from Cyton. Similar to our amazing BBL Hero treatments, you will find that BBL HEROic is also an extremely quick and comfortable treatment. But one thing that makes BBL HEROic unique is its special 532 Plus nano filter. This special filter precisely targets both melanin and hemoglobin, which is particularly beneficial for treating those delicate vessels around the nose and more challenging pigmented lesions that can be found on your face and body. Another thing we love about our new BBL HEROic treatment is the added intelligent control. This allows for an even, precise treatment every single time and leaves you with results you can't wait to show off.
We'd now like to introduce one of our amazing laser specialists, Dawn Marie. Dawn Marie is in our Inside the Beltline location. She's been an esthetician since 2010. She is absolutely amazing and so skilled as a laser provider. She is particularly fond of treatments such as Halo, Genius RF microneedling, BBL, and MOXI. You can tell how passionate she is just by meeting her and helping correct patients' skin and getting them to their skin goals. Dawn Marie is going to be performing this next demo of BBL HEROic. Please enjoy.
And then I'm going to treat your right side. I'm going to go to your left side. I'm going to go to your right side, right side till I count enough pulses. And then I'm going to do your forehead, around your mouth and chin, then your nose. I'm going to move right on down. I'm going to do one side of your neck, then the other side of your neck, and then the same thing with your chest. I'm going to split that on 2 weeks. Okay? Once I've done that, it's going to be like your base pass. And then I'm going to go back in and I'm going to do correctives in the areas on your face that need correcting once I see them. Okay. And any areas on your neck and chest that need that. Okay. And the first pass is to basically just push energy and heat into the skin to kind of prepare the chromophores for their corrective pass. This will go ahead and help with pores, texture. This is like your fine pass. Not too crazy, right? Not too bad. Light, ready? Yep. Same dinky. That feel okay? Mm-hmm. Yeah, it's not a big deal. it's going to take you a little while for that to go away. Probably feels a bit of a sunburn right now. Yeah. That's going to dissipate. Okay. These little guys, they don't have any more heat in them. They're just kind of reacting. That guy's going to get itchy. The little red thing that you had that's now round. He's normal. Just pat it. Don't scratch it. This will more likely turn to coffee grind and fall off. It may be lighter. It also may be gone.
In this slide, you'll see the post-care products that Dawn Marie recommended for her patient. She recommended by revision a gentle cleanser and a physical sunscreen to help protect and keep the skin nice and clean without irritating it. She recommended 2 Skin by Synergy products. One is an antioxidant, which will give additional protection and healing benefits to the skin. And the other product is a hyaluronic acid product that is going to keep this patient's skin really, really hydrated as she experiences some of the healing processes by this laser treatment. And then she also recommended a moisturizer by Elta MD that will help prevent any future breakouts while providing a nice barrier on the patient's skin. We're going to jump now to our patient testimonial post BBL HEROic with Dawn Marie.
My name is Megan Pintel. I am at Synergy and I just got the BBL treatment, and it's my first time getting laser treatment done, and I just finished getting the treatment done. It feels so much better already, and the reason I came in is because I have experienced sun damage and I had shingles when I was younger, so I had some trouble spots right here and there's some numbness in my face just naturally from that. So I wanted to treat the pores there and the dark spots and things that I have accumulated over time. And I really feel like this treatment is going to help with that, and I'm excited to see the results. So stay tuned where I'll do an update for the next couple of days where I'll show those results.
Our next session is all about MOXI. MOXI is a fractionated laser, meaning instead of ablating the surface of the skin, it's putting microchannels caused by thermal energy into the skin to stimulate collagen and treat deeper hyperpigmentation. By creating an injury this way, healing is a little bit faster and safer. This is appropriate for all skin types and is even safe for melasma patients. Performing our MOXI demo is another lovely Inside the Beltline location specialist, Emmeline. Emmeline has been in the industry for the last 6 years and particularly loves MOXI for its versatility. Please enjoy our MOXI demo featuring Emmeline. Let's walk through a MOXI treatment. So before any laser, we get our consent signed and take a Visia photo in our imaging device to make sure we have very clear before photos and also something to compare the after photos to. This gives a really in-depth analysis of skin and pigment. Then we are going to cleanse the skin always. We will then apply a topical numbing cream to help with any discomfort for the treatment. Now removing the numbing cream and applying eye shields. We also give a Zimmer chiller to the patients for additional comfort. Now I'm just laying down passes on this patient. Typically you would see a back and forth pass, but this particular patient has melasma. So to allow each pass to settle back temperature-wise, we just lay the passes down one at a time. After the treatment, we're going to spray Velez spray on the skin. We are applying a CMT post-procedure cream. Look how beautiful she looks. And then we're going to go over post-care. Featured in this slide is our lovely MOXI Models Healing Diary. You can see that 2 days following the MOXI treatment, she looks fairly normal. Some of the pigment has darkened a little bit on her skin, and that's going to slough off. Her skin also feels a bit sandpapery, which you can't really tell. That's the beautiful thing about MOXI, but that will also slough off in the next few days. Day 3, you'll notice that some of that has already sloughed off. She's a little pink just because of that fresh skin that is emerging underneath. But visibly, she looks very normal, able to go to work, able to live her life. Very, very simple downtime with MOXI. Our next treatment is going to be the BBL MOXI stacked combination treatment. BBL is attracted to surface pigment, redness, and veins, where MOXI is able to penetrate the skin to go after the deeper pigmentation. By combining these two treatments, you're able to clear the visible sun damage and redness while also correcting deeper hyperpigmentation. During your complimentary Visia skin analysis, your laser specialist will determine if your skin type is appropriate for this combination. And demoing our BBL MOXI combination treatment is going to be laser specialist Cheryl. Cheryl is at our North Raleigh location and has been with Synergy since 2019. She is so skilled, so talented, so passionate. She loves doing BBL because she is able to correct multiple different concerns. Please enjoy Cheryl demoing BBL MOXI.
Hi, I'm Cheryl. I'm one of the laser practitioners at Synergy in North Raleigh, North Carolina. I am with my beautiful patient. Today we are prepping her with some numbing cream, getting her prepared for a MOXI BBL stacked combination, one of my personal favorites. This is amazing for clients of any age suffering with sun damage, redness, pores, texture, melasma, just about anything. So along with our topical lidocaine and tetracaine gel, I'm also going to give this patient the option to use laughing gas. Laughing gas really takes the edge off of laser treatments. It really helps ease anxiety. So ours is nitrous and oxygen. It's cut 50-50. It is completely safe to drive afterwards. It leaves your body in about 5 minutes. All right, so I'm just gonna go ahead and remove her numbing cream now. I also want to talk about why I picked MOXI BBL combination for this patient. This patient, if you're looking closely and at her Visia before photos, has a lot of redness happening in her T-zone, her cheeks, chin. She also has some capillaries right through here. This patient does struggle with rosacea. So the BBL is really going to help us get to that 560 nanometer to really help collapse those blood vessels. And then I picked the MOXI because she also struggles with texture and pore size. So that is going to help slightly resurface that top layer of skin, hopefully give her a little pore minimization and then an overall texture and glow improvement.
I am putting protective shields on this patient and going to do a very generous layer of ultrasound gel. This gives a nice glide to the skin. Of course, eye protection. So this first treatment, we are going to do some base passes of the 560 filter. Here I am just checking in with the patient, making sure she is comfortable, that it didn't hurt too bad. I usually ask on a scale of 1 to 10, what is the pain feeling like? Just to help gauge her comfort level, make sure she's not too sensitive. I always stop after a test pulse and look at the skin, give it a little bit and make sure the skin is responding appropriately. Appropriate response usually is no response, right in the beginning anyways. So here we're going to do multiple passes, heating up the skin. This helps kind of induce collagen and preps for the other passes that we're going to do that are more corrective and more pinpointed. Again, I am just checking in with how she's feeling, getting a thumbs up for her, that she is still doing well. And as you can see, the skin isn't changing in color too much, which is ideal for your base passes. Here I am changing the adapter. So we have smaller amount of light coming out, which makes it more potent. And we are going to use this on smaller areas like the forehead, nose, and chin. I also use this adapter for the next pass that we're going to do that is more of a corrective pass. So the next one we're going to do is focusing way more energy through that adapter to help collapse telangiectasia, which is just broken little capillaries that cause a rosacea look in the skin. It is a higher heat, but I do give the cold air for this one that really helps ease the discomfort with the patient. And for this, we only do one pass all over the face. With this one, sometimes I do get some response. Sometimes the skin gets a little bit red. And here you could see a new adapter. So this one is really small and pinpointed to really address tiny capillaries, red marks. As you see on this patient, she has a few red dots on her cheeks and nose. We're going to go in and really helps collapse those. There is usually an immediate response with this, either a blurring of the vessel or a disappearance of the vessel. I normally hit these spots about 3 times, so I go over it 3 times. Again, the cold air. All right, so here is the final step, the MOXI. So since we did a full corrective on this patient, we are going to do a lower MOXI. So we're doing a level 2. The cold air will help with the heat. I'm going to do 4 passes on this patient. So the patients instantly get red. She's going to feel the heat almost immediately, but definitely within the next 5 to 10 minutes, she'll really feel her skin heating up. She'll get a sensation of almost like a really bad sunburn. Here you could see she had a little bit of petechiae, which are just tiny little blood vessels that are sitting at the surface of the skin. They're painless. Your body will reabsorb them in about 3 days. And here comes the best part, the Velez mask. This is an amazing post-procedure cooling mask. It consists of biocellulose water.
Cheryl is now going to discuss her post-care recommendations for BBL and MOXI.
So I put the Velez hydrating mask directly on my client immediately after the MOXI was finished. So I stopped the MOXI, I put this on. This has cellulose in it and water. Those 2 ingredients are really good at kind of absorbing the heat out of the skin. It makes the heat in the skin go from a 10 to literally like a 2. We use this after a lot of different laser treatments, any that involve post-heat. So we put this on. She could leave this on for up to 2 hours if she were to use it at home. In clinic, we'll put it on for maybe about 15 to 20 minutes, and then that gives enough heat reduction where they could drive home comfortably. We also sell these so they can take them home and then do it again when they get home. Also from Velez is our water, thermal spring water. This you spray it on the face and it gives instant cooling and hydration to the skin without you having to actually apply something with your fingertips, which I personally love an aerosol because it keeps it more sanitary. So this feels great. They could use this for the following week afterwards as many times as they want throughout the day. But mainly on that drive home, it feels really good to spray it and then blast your AC in the car. And then finally, out of the trio for post-care, we have the Revision CMT. CMT stands for chemical, mechanical, and thermal. So anything that's kind of injuring the tissue, you could use this afterwards to reduce heat, discomfort, speed up healing. It actually helps even with swelling. Mainly though, in my opinion, this helps the most with redness and dryness. So a lot of laser treatments, you are flaky and red for a while. This will cut that downtime in about half. So I love this twice a day for about 5 days after treatment. Thank you for watching me perform a MOXI BBL with my lovely patient. If you have any further questions or you don't know which laser is right for you, I always recommend coming in for a consultation, a Visia skin analysis where we take pictures of your skin so we could really customize the treatment plan for you specifically. Also check out Cyton's website to learn more about all the lasers that are offered by Cyton. Have a great day.
Next up, we have a quick video showing the Velez post-mask benefits. Please enjoy.
Hi, my name is Vesna Smith, and I'm the co-founder and CEO of Velez brand. At Velez, we believe in harmony of nature and science. Our products are crafted with the purest natural ingredients in combination with the cutting-edge biotechnology to bring your superior skincare solution to your practice. One of our standout product is the industry-leading Intense Hydration Face Mask. It's known for its cooling, hydrating, and soothing benefits. When it comes to cooling, reduces the body or skin temperature by 6 degrees Celsius and provides constant cooling effect for up to 2 hours. When it comes to hydration, the masks provide 10 times more hydration than any mask on the market, and the masks are made of 95 to 98% water and 100% natural biotech cellulose, so there are no active ingredients. So you don't have to worry about any kind of reaction. When it comes to soothing, it provides amazing soothing benefits by visibly reducing redness and swelling, promotes the healing, and reduces the downtime. To complement our Intense Hydration Face Mask, we recently launched HOCL Hydrating Mist. Not sure if you are using the product or if you heard about the product, but this is a great pre and post in-room treatment. And also you can send patient home with the mist as well, cool, cleanse, and calm the skin. It's known to help with hydration, redness, itchiness. It's antibacterial, antimicrobial. It's a great addition to any gym bag as a cleanser or everyday toner. We really are unique in a way is our packaging. It's a bag on valve. Basically, it keeps the formula most stable and also contamination free, and it's very easy to use. It has a very unique mist.
Moving on to Halo. Halo is the ultimate hybrid laser treatment. This technology is going to combine two wavelengths. The first wavelength ablates the very top layer and corrects texture, tone, and especially effective in improving the appearance of pores, which patients love. It's also great for improving acne scars. The secondary wavelength stimulates collagen and elastin, improving deeper wrinkles, giving the skin an overall youthful glow. Halo is appropriate for all skin types, including melasma. So if you're a Synergy regular, you've probably met or seen this lovely human in passing. If you have not been to Synergy yet, we are pleased to introduce you to one of the laser specialists at our North Raleigh location, Bridget. Bridget has been with Synergy for a very long time. She's been with Synergy for the past 16 years, and we have absolutely loved having her expertise. She is a wealth of knowledge. She is our lead laser trainer. So all of our laser specialists have learned from her. She is going to be demoing our Halo portion of the evening. And you will also see her in our Halo MOXI combination demo. Please enjoy our Halo demo featuring Bridget.
Found this in-house. It's a 23/7 compounded topical numbing, and we'll have you numb for 45 minutes. This is going to help speed up your healing. So we were able to see in your Vizia that you have a lot of pore activity, some textural issues, hyperpigmentation as well, and of course always the anti-aging portion of it. So we are going to layer on, it's called a stacked technology. We're going to layer on MOXI and then your Halo, and that is going to give us more correction for your pores and hyperpigmentation. It will add a little more swelling in your cheeks day 2 and 3, but the texture, which is going to be your men's, it will be about the same. It might be slightly darker where you've got more hyperpigmentation, but very manageable downtime with the post-care kit that you have. Okay. And this is Purison. We're just sanitizing the skin, getting it really clean and dry before we start. And you a Zimmer, so you get to participate in this. And I'll take this hand, and this is just cold air that you control. It just helps to take some of the heat out of the skin. I can move around it
Tell me where to not put my hand.
There's no wrong place. You're not in my way at all.
Okay. Just keep it down here.
Yeah.
Okay.
And then I'm going to have you lift up in the back. We are going to start with MOXI, which is a non-ablative resurfacing technology with Cyton. I'm going to roll multiple times over each area of the face. And as I'm rolling, you're going to feel like little pricklies that basically are creating channels, like aerating a lawn on your skin. This is what causes the mends in the skin. It goes in, the laser pushes those skin cells to the surface and leaves that sandpaper texture that you'll have tomorrow, okay?
Okay.
I'm going to start right over here.
Kind of like the micro needle feel.
It feels different. I'm going to do one line as an example so you kind of see what it feels like. Okay. 1, 2, 3. Okay. And the forehead is the most uncomfortable. And this will really help improve your hyperpigmentation. Now, during the healing process, don't pick or scratch any of that texture off. Keep everything very hydrated, sun protection, hat. We're using 2 different devices to address 2 different depths of the skin to give you more improvement and correction in one treatment. This does not affect hair. So I'm going to run this along the hairline where you have some hyperpigmentation.
Feels almost like an exfoliation with a little tingle.
On a scale of 1 to 10, 10 being the most uncomfortable, where would you put the discomfort?
3.
You'll probably notice your skin starting to warm up overall. And this will not affect your lip filler, obviously, at all. All right, you can relax.
I'd change my pain scale. I'd say the forehead is maybe a 3.
Okay.
Upper cheeks like a 2 and like nothing at
the lower face.
Chin. Yeah, lower face at all.
We'll now move to our Halo MOXI combination treatment of the evening. Combining these 2 modalities, you're adding enhanced benefits to both. While Halo is a great standalone treatment, when you add MOXI, you're able to reach additional layers of the skin where other damage has occurred. MOXI is going to correct pigment, while Halo is correcting deeper wrinkles and skin surface concerns. While this combination can be appropriate for all skin types, patients really need to work with their laser specialist to properly prepare for a treatment of this nature. This dual treatment should not be done on patients that have never had a laser treatment, but you can absolutely work your skin up to receiving a treatment like this. Please enjoy Halo MOXI.
Initializing Halo. So Halo, which is the next step, is a combination of ablative and non-ablative resurfacing. We're going to turn on a buffalo filter. And what we're going to do is measure the treatment area first. And that just gives us the surface area measurements so we get a more precise treatment. I'm going to start with the right side. Just, you won't feel anything but rolling. So, you may notice when we're done that you may have white little dots on the skin, and that is part of the aerating part, the aeration of the 29 the aeration of the 1470. And what it is pushing the dead skin cells in those channels to the surface of the skin. They will wipe clean, but you may notice a little bit of that white color. And they're basically just dead skin cells. The buffalo filter keeps the room from filling up with dead skin cells so that we are not breathing those in. We're 50% done with the forehead. Just going to clean the dead skin cells from the device. I'm going to come back in for the second part. So this device, unfortunately, does not affect any of the hypopigmentation that you've probably got from scarring or sun exposure. And that's the little white patches that you have around.
Do not do halo on.
Active pustule acne are not candidates for halo pustules. It is great for acne scarring. Darker fit type are great candidates with free topical treatments. Melasma patients are very good candidates with the right settings and prepping before the treatment. So anyone really is a great candidate. You normally do these in a series of 1 or 2, depending on the level of sun damage. Acne scarring can need up to 4. Full results from Halo are achieved at the 90-day mark post. You will notice that about 14 days, your skin looks very glowy, more healthy, pigmentation's improved. We recommend dermaplaning, just with the men's removal at about 7 to 10 days as well. And all of our locations provide that service. Is your level of discomfort still low?
Yes.
Perfect. This is a spicy treatment afterwards, but for the most part, it's not a painful procedure, just warm. So sun exposure for MOXI and BBL are not as strict as BBL because the devices are color blind. They're drawn to water, not to hemoglobin and melanin. So if you were at the beach or in the sun last weekend, not a deal breaker unless you actually have a sunburn. But with any laser, you're going to be more sensitive post. So you really have to be very, very careful, especially for the first 3 months when you're out in the sun wearing a physical sunscreen and a hat for protection. Elizabeth and I discussed prior to her intake if she was prone to cold sores. If you are prone to cold sores, you will need to take antiviral pre-treatment or day of to prevent an outbreak. Anytime we're putting a lot of heat into the skin, it can trigger that dormant virus to activate. And with Halo, it actually can spread to other areas of the face because of the ablative nature of Halo. Because of the topical numbing component, we do not want to treat anyone who is pregnant or breastfeeding. It wouldn't matter as long as you're done breastfeeding. A lot of moms find it very helpful to come in for a laser resurfacing because you can't do very much topically or laser-wise during pregnancy and breastfeeding. And Halo is a great way to get your kind of refreshed glow back with very manageable downtime. So Botox, it doesn't matter. If she had Botox yesterday, we could still treat her today. Filler, we normally spread those out about 2 weeks before or 2 weeks after, unless it's a very superficial filler like Volux or Velour. on the lower face. You want to spread out. I would always recommend doing your halo first and then your filler. But if you decide to get filler first, you want to wait 4 weeks after those superficial smaller molecule fillers so that we don't dissolve any of the filler. So I am cleaning the pinprick bleeding that we have here. Sanitizing the skin one more time before I spray it with a BBL spray and apply a CMT. How are you feeling, Elizabeth?
Good.
Good? I'm going to pull your glasses off. It's going to be bright. Keep that air going. You can see she already has a little bit of edema starting in her cheeks because we did deliver a lot of energy. And if you'll keep your eyes closed for me, I'm going to spray. It's going to be beautiful in about 2 weeks. So CMT is a revision product, and it will be your moisturizer 2 to 3 times a day post. And we found that it actually decreases the recovery time post-halo.
Scale of 1 to 10. I'd put it at a 5.5. It's feeling a little warm now.
You will notice it more once you're not holding that dimmer. You're completely ibuprofen or Tylenol.
Which do you think is better?
It depends on the person. I think ibuprofen tends to work a little better. Mm-hmm. In your post-care bag, you've got a gentle cleanser. There's a little fan in here. I recommend on the way home just blasting the air conditioner on your face to make you more comfortable. But there is a little portable fan. CMT is the post-care cream that you're going to use twice a day. Mm-hmm. Keep it as hydrated, moist as possible. If you have any itching, sometimes when the skin's recovering from a controlled trauma, you can have a little bit of like itching during the healing process. 1% hydrocortisone will fix that. Okay. That's what you probably have over on the counter at your house. Yeah. And then there's some samples of a physical sunscreen in here. Okay. That you can use as well. Take the BBL mask. It's a sheet mask, like a one-piece sheet mask. Pull the plastic off the back and then place it on your face. Okay. Lay down and enjoy it for about 45 minutes to an hour. Okay. And once you remove it, that should pull the heat out so that you're not uncomfortable.
Oh, okay. So I do that when I get home.
As soon as you get home.
Okay.
We'll now hear the testimonial from our Halo model. This testimonial was filmed about 2 weeks post her Halo treatment.
Hi, my name is Elizabeth. I'm 41 years old, and I received a MOXI Halo laser combination last week. I have received laser treatments in the past, but what made me really interested in the MOXI and the Halo combination is the longer lasting results that I can't wait to see in 90 days for the collagen and the elastin to start regenerating. So for the MOXI portion of the procedure, it felt kind of tingly and like it was opening up my skin. The Halo portion felt like it was pressing heat down into the skin. On a scale of 1 to 10, my discomfort level never reached above a 5. I think I rated it as a 2 on my forehead, 3 to 4 on the cheek area, and I really didn't feel anything on the lower face or chin at all. And for my post-care, when I got home, they sent me with a BBL post-treatment mask. And as soon as I put it on, it relieved everything. I left it on for about 45 minutes to an hour. And afterwards, all the other sensations had dissipated. The next morning, I used the post-care kit that they sent home with me that had a gentle cleanser, the CMT cream, and the SPF sunscreen. I was able to go to work the next day. The second day, that night I repeated the post-care kit. And the following day, I did stay home. That's when it starts to get a little rough feeling. And day 3 was also some downtime and a little bit, it was itchier on the 3rd day. Day 3 would be my most uncomfortable day from the experience. That's the morning I woke up with the most amount of swelling. So I believe I'm on day 10 or 11 now. I'm in the breakout phase. I'm still healing. On day 14, I'm excited to see this kind of clear up. And I'm just continuing to avoid any sun exposure, touching my face, and using makeup. My before and after photos have been taken pretty close together, but being able to see them today, I already noticed the pigment is improving, even some of my fine lines and wrinkles. I'm really excited to see my final results in 90 days, where all of the things that the laser treats should all come together. So overall, my experience has been amazing. The MOXI is something I would consider doing probably about 4 times a year, and the Halo I will absolutely be back for next year. Results that I've accomplished previously just felt like it took all of the damage that I've done a whole year just off of my face. The staff at Synergy has been amazing. They've walked me through every bit of the process, the care, the cleanliness, the friendliness. It's just been wonderful.
Now we'll hear from our double board certified plastic surgeon, Dr. Hughes, and Bridget, our laser specialist, on Halo post-care recommendations.
So the next laser we're going to talk about is Halo. It's a phenomenal treatment. It can address sun damage, it can address fine lines and wrinkles, and address some skin laxity. It can also be combined with other modalities. But if you've had a Halo, what are we going to expect from the recovery?
Post-care. Halo is one of my favorites. Post-care is very straightforward. You'll receive a kit with a very gentle cleanser, our CMT cream, which is specially designed to improve the recovery time, physical SPF. I also always recommend the Intensity face mask, which will help to pull that intense heat out of the skin for the first hour after treatment. Also, the BBL spray will help with an antibacterial and antimicrobial to decrease the risk of infection.
And it cools things off.
Beautifully. The full recovery is anywhere from 5 to 7 days. Patients have different levels of swelling. Some have none. Some have a little more significant swelling, which you can use an antihistamine to help manage that. But full recovery is anywhere from 5 to 7 days. The results are beautiful.
And during that time, they're going to be red, sometimes pink, stay out of the sun.
Itchy is normal during the healing process.
Maybe not do it before a big event.
Correct.
Not a week before a big event.
Usually if you have something big a month before, we'll give you beautiful glowy skin.
How about pain? Is it painful? Outside of that first couple hours where you do feel that heat, do people describe that it's painful? How do they describe it, say, 2 days after?
2 days after, dry and itchy. During the procedure, it's very warm, intense heat. But once that heat dissipates, it's very tolerable as long as you keep the skin moist.
And that comes in the kit, right?
Everything comes in the kit. Yeah.
Halo is a great product.
We will now demo our BBL Forever Clear treatment. Performing our BBL Forever Clear treatment is our laser specialist, Vicki. She is in our Cary and North Raleigh location. Vicki is a very passionate laser specialist. She received her certification in 2009 in Scottsdale, Arizona at the Laser Institute. She really enjoys treating acne, loves treating melasma, and just overall hyperpigmentation. Please enjoy BBL Forever Clear.
Any recent sun exposure, sunless tanner, or antibiotics in the last couple weeks?
Like 3 weeks.
Okay, perfect. All right, we'll go ahead and take some pictures of you. Just telling her that when it comes to that acne clear, there's a couple of different settings that we kind of go through. And that first one, it's a little bright and it can be a little stingy because it's trying to kill bacteria and it's trying to control some of that excess oil. So that's actually the first phase of it. I'm going to put some cold gel on you first. I'll do a couple little pulses and make sure that we've got a good setting, and then we'll kind of go on from there. But with this particular laser, you're still going to actually see some light. It's still kind of bright, but your eyes are completely protected. I'm going to have you look to the left for me. So where would you say when you get breakouts that it mainly happens?
Around my jawline and chin the most, for sure.
So not so much like nose or forehead or anything like that?
No, for the most part it's like hormonal.
Okay.
And usually fairly cystic.
Okay. And then a little bit like around this neck area right here? Okay. Doing these kind of treatments, you normally want to do anywhere between 4 to 6 treatments. And you really want to do them like 2 weeks apart. Doing them 2 weeks apart, you're going to be able to kill some of that bacteria, control some of what is happening with the skin, and then also prevent future breakouts. Some people can get through 4 treatments and they're good. Other people will end up having to do 6. And then depending on like what's going on with your skin, you might have to do that series of 6. And then whenever you feel like a breakout is happening, you might have to do 1 or 2 just to kind of help maintain it. If you notice it's like right before a cycle or something like that, it might be a good idea just to come in right before that, just to prevent those breakouts from happening. You're going to start right in this little corner on your temple to the right. I'm going to do 1 little pulse, give you an idea of what it feels like, and we'll go from there. All right, here we go. 1, 2, 3. 1 to 10, 10 being the worst pain ever. What would you say?
Like 0.
Okay, perfect.
Like hardly felt it. Just
Perfect.
a little warm.
Okay. Still doing good? Awesome. Come right under the chin. Times with this particular one, you'll notice that it starts to warm up a little bit more. I'm going to have you straighten up for me. In those areas where you have a little bit more oil or a little bit more redness in those areas, you might feel a little bit more of heat or tingling. Eyes are very protected. All right, we're going to come back over on this side, okay? This particular treatment is you're going to be probably a little pink, maybe for 30 minutes. Sometimes it can be a little bit longer than that, but then it usually subsides. And then if there's like any dark spots or anything like that, those will darken up for the next like 12 hours and then slowly start to kind of flake off.
So it's like no downtime. Could I put on makeup?
Absolutely.
Like later this afternoon?
Yep.
Oh, cool.
Yep. Usually within 30 minutes, your skin will start to feel pretty normal and you can absolutely put makeup on. All right, we're going to do another pulse. Doing awesome. A little spicier through here. That's where your breakouts are, so that's why you're feeling it a little bit more. All right. Next section is going after like diffused redness. So any kind of redness that you have like underlying that could be caused from the breakouts. Because a lot of times what happens whenever you have a breakout, you'll have that pustule, but then that will heal, but then you end up being left with a red spot or some hyperpigmentation. So I can kind of go in there and hit that red so that it heals a little bit faster.
Yeah, I would say that is what makes me feel like my breakouts last.
So with this one, I usually tell people that this one is a lot more tolerable. I'm just going to do one pulse at a time. A little bit more in that area.
Just a little bit.
Just a little bit, because we're going to go after those individual spots or breakouts. And the reason why I hit it with a smaller one is it puts a little bit more energy into those breakouts so that we can get those to heal a little bit faster. Yeah. So right now I'm just kind of looking for those more raised pustulars that are really red, because this is going to kind of absorb that energy into the redness and break down those blood vessels to make those go away. So right now I'm just basically going to go ahead and take this gel off you and wipe you down. The biggest things that I would say today is that you just don't want to overheat your body today. So like no jacuzzi, steam room, saunas, or hot tubs. We just put a lot of energy in the skin, so we don't want you adding energy from like working out or being out in the sun. I'm actually going to put some products on there that are just going to help with the healing process. You want to keep it nice and moisturized, and it's extremely important for you to be using a medical grade physical SPF. The physical SPF is great for causing the sun to be reflected off the skin instead of absorbed, and so it is great for post-care treatments to have a physical sunscreen. Physical sunscreen also is amazing for helping with any kind of redness, and it's naturally calming to the skin. So if you already have inflammation and redness anyways, it's a great product to just use on a daily. And then anytime you're doing any kind of laser treatments, you don't want to be using anything aggressive or active on the skin. So like no retinol, retin-A, scrubs or anything like that for a minimum of 3 days, but it can be up to 2 weeks depending on how sensitive your skin is. To help prevent some of the breakouts, I always say like using a nice exfoliating cleanser that's got at least some salicylic in there. The salicylic is going to help with controlling some of that excess oil. And when it comes to breakouts, it's because of the fact that our body is producing too much oil, and then bacteria loves oil, so then it comes and breeds so that you end up with those breakouts. So using a nice little exfoliator like our papaya enzyme from Revision is amazing. And then keeping it hydrated with a nice moisturizer and your SPF. It is completely fine to wear makeup afterwards. It's not going to keep you from wearing any kind of makeup. But I will say if there's any kind of dark spots from like sun damage or anything like that, those continue to darken up for the next 12 hours. So you might get that like dark speckling that looks very similar to like coffee grounds or black pepper. Don't pick at them or anything like that. You want to just basically let them slough off so that they lighten up. Yeah, and then you want to make sure that you go ahead and get your next appointment scheduled because we want you back in 2 weeks. And we'll do at least 6 of them to help get the skin nice and clear. Elta MD. So this Elta MD, this is the Elements. This is actually their physical sunscreen. So it has a moisturizer, and then it has the physical sunscreen, so it's going to block the sun so that we don't end up having any scarring from the current breakouts. There we go. Here's the other one. Perfect. So your skin's going to be a little pink for about 30 minutes, and then usually that will start to subside. Really important that you don't overheat your body today. So if it's really hot outside, you just want to make sure that you turn your AC on. That will prevent it from feeling irritated. If for some reason you feel like later on your skin starts to heat up or it gets a little irritated, you can always use like a little cold compress. There's laser enzyme gel that is great for just kind of cooling the skin. The CMT that I put on you as a post-care is also great for just kind of calming the skin down. And then we'll just get you on the books for 2 weeks. All right.